know the great thing to do, and if we would just kind of, get up our ducks and start working at it, or if we would snap our fingers and make something magically happen, that I could cure your lung problems. The difficulty is you have an incurable lung disease that is never going to get really better. It'll have worse times and then less worse times, but the progression is pretty, without treatment it kind of goes like this, with treatment it goes like this. What it doesn't do is this. So the best we can hope to do is to stabilize your lung function and give you few acute illnesses, but unfortunately we're not probably going to be able to stop it from happening forever. And we are going to see gradual slow decline. Probably at least every several months we ought to be checking breathing tests. We could check a CAT scan, probably not any more often than about once a year, just because that's a fair amount of radiation. The chest x-ray you had done at Reddington a couple of days ago shows maybe a tiny bit more worsening compared to what we had back a year ago, but not a lot of change. And the problem too is when you come to the emergency room, they're going to call this pneumonia even though it isn't, because it looks like pneumonia, and they may or may not understand that you can get pulmonary fibrosis can sometimes look like pneumonia. Now you can have pneumonia on top of fibrosis, it is true, but it is also true that the fibrosis itself can give you cough and phlegm and shortness of breath and a low oxygen level. And it's not to say that antibiotics will never help you, it's just to say they're not going to cure this process, and it's not a reasonable expectation that you're going to leave the hospital feeling totally well and good. I mean, I wish to heaven I had the ability to do that, but I don't. Let's see, your last breathing test you had done was about 6 months ago. That was reasonably significantly bad. And of course you were coughing with that, so that made it a little bit tougher to do too. We've done these walking tests on you. Here's one from back a year ago where when you walked, your oxygen level kind of skirted with getting low enough to where it needed to be helped. And if it's worsened, I would suspect that it very well may have indeed been the case. So the little bright spot here is the overnight test the test that they did to see how your sleep apnea is being treated, despite the fact that you're not a big fan of the mask and everything. Your machine seems to be working for you, and it's keeping your oxygen, it's keeping your breathing where it needs to be from the standpoint of the sleep apnea. So you do have both independently. You have both pulmonary fibrosis and you have the sleep apnea. The sleep apnea is being helped with the CPAP, but it's not doing anything for the fibrosis. The fibrosis that we're using the Esbriet to treat with the hope that it will slow down its progression, but at some point you're going to reach a point where you do need to be on oxygen. With any activity, you may already be there. And unfortunately, you may need to use more oxygen than is convenient for you to use.
What about a lung transplant?
Well, a lung transplant would be about the only way to totally take care of the problem in the lungs. The difficulty is that they don't do them in the state of Maine. We'd have to send you out to someplace like Massachusetts, Boston. There's a couple of programs there. You need to go live down in Boston or the area for a while, and you need to get set up, either have a lot of cash in your pocket or get set up with Massachusetts Medicaid to pay for it.
Yeah, I used to live in Mass. I was born in Westbrook, Rhode Island.
Yeah. Do you have any information on that?
What?
The Massachusetts or any of the places that they do the surgeries at?
Well, yes and no. They're publicly available. If you're saying I want to be referred down for a lung transplant and I want to be seen, probably an even better choice would be matters, there is there's the major hospital that does most of the really expert lung work in Boston is the Brigham and Women's Hospital over on Fruit Street. You probably have been by there once or twice, or remember having heard of it or seen it. There is a interstitial lung disease, a pulmonary fibrosis clinic there that certainly can see people that can be, they can possibly make sure that we have the right thing, and they can also, they can work with you to get set up and listed for a transplant. One of the difficulties with lung transplantation is that it's not like you go into Murphy's Auto Parts and you get a muffler for a 57 Chevy, and they've got 4 of them sitting on a shelf and they just give you one. The trouble is there are critical shortages of transplantable organs, and people die every year on the waiting list waiting to get an organ. So that being the case, they've learned to be, and it's kind of sad, it's kind of like the Titanic is going down and you have to decide which passengers are going to drown and which passengers are going to make it into lifeboats. They have to become pretty vigorous about making tough choices, and there are things that they look at in terms of age, in terms of overall health status, etc. I'm not saying that I will make the choice for them. They make their own choices, but I can say that they may look at your 68 years and they may say, well, there was a 20-year-old who's for sure going to die unless he gets this organ. We'd rather give it to them than to you, just because they're more likely to live longer with it. That may or may not be the case. So if you're saying, if you're asking me to make a referral to the lung transplant center at Brigham and Women's, yes, I can do that. They probably will need to repeat a lot of the tests that we have already done, and they may or may not decide to go ahead and list you. But if you want to go down there and have that evaluation and be told that by them, then I have no problem making that referral.
At some point we probably will, but not today, but I just want to talk about
Well,
it.
you're not going to go there today, but
Right.
if I put in the referral today, then it'll be months before you get an appointment from there. So if you really think you're more likely than not to want to do that, I should probably get the paperwork started. If you're not even sure you want to mess with that, then I don't have to do that. And you can let me know if and when you decide you want to do that. But if you're pretty sure that you want to explore that option, then the sooner we get started, it's going to be several months anyway. We want to have any chance of getting you in there before the end of the summer, before weather starts getting colder again and you're traveling down there in December, then we may want to kind of get into the process. But
well, you can send it over, and if we decide not to, then we can always cancel it.
yeah, of course. So I would say